supportive medicine, whatever. Thank you.
Thank you. Thank you very much for the question. If I understand your question, what is the characteristics of these patients?
Yes.
Are there comorbidities? In the field of infertility, it spans every aspect of a woman's life from age 18 to my oldest patient was 60 years old. So we do fertility across the age spectrum. Within that, there are very many comorbidities. In America now, obesity is becoming a very big issue. The issue of irregular periods associated with obesity, very big issue. Pre-diabetes, very big issue. When we do our studies, one of the advantages of working with fertile patients or infertile patients is they tend to be young and healthy, so it's an easier medicine. However, as women are aging, very many women want children in their 30s and 40s and 50s. So we have to deal with it. Most of our studies were done in 1999 to 2009. Although obesity was there, it wasn't as rampant. Most of these women don't have many comorbidities. The comorbidities accentuate the infertility, and we must be aware of that. So it does apply because the way traditional Chinese medicine works and the way we demonstrated it worked on these stress hormones was across all ages. Most of our original studies were older women, and most of our studies, even though it was treating women, we found that their husbands or partners had a sperm issue, and even though they had a sperm issue, by adding acupuncture to the woman, she was more susceptible to pregnancy. So it does cross all ages, and it does cross comorbidities. It is harder now with the comorbidities, and we believe very strongly that nutrition, lifestyle, alcohol, tobacco, drugs are very harmful. For women, caffeine is very harmful. That's very hard for some American women to understand. We do think that there are pesticides and herbicides and things in the environment that do influence their ability to achieve a pregnancy. It's multifactorial. That's the fascination about this. It's multifactorial. Thank you for your question. Thank you.
We have time for one question, perhaps the gentleman here, and then we'll break. And please feel free to approach.
Good morning. Thank you for your presentation, Dr. Paul. Correct me if I'm wrong. You mentioned that 11 treatments were sort of the optimal outcome for successful outcome. Is there a specific time where you give those treatments?
Excellent question. The question was, I made the statement that there was a certain number of treatments that were required for us to see an effect more than 50% of the time. It's a statistical analysis. Dr. Credenda this afternoon is going to be talking about the acupuncture points. She's going to be talking about when the treatments are given and how they're given. As what's misunderstood is I'm not an acupuncturist, I'm a Western-trained physician. But Dr. Credenda will be spending a lot more detail this afternoon. It's not that I can't answer it, but I think she'll be more informative.
Thank you very much.
Thank you. Thank you.